Hi, welcome to this month's training webisode. Today we're going to talk about 12-lead EKG acquisition. We'll talk about some specifics, indications on when to perform a 12-lead. Talk about lead placement. That's very crucial when you're performing a 12-lead EKG. We won't discuss 12-lead EKG recognition. That'll be for another webisode. Now let's talk about some indications on when to use a 12-lead. Some indications when to use a 12-lead will be found in your protocol manual, procedure 5.2.6. All chest pain patients over the age of 18 should get a 12-lead EKG. Cardiac dysrhythmias, where the heart rate is greater than 150 or the heart rate is less than 50 beats per minute. Patients complaining of epigastric pain should get a 12-lead. Patients complaining of back pain without any obvious trauma need to have a 12-lead performed. Diaphoresis that's not explained by environmental or fever should also receive a 12-lead. Sudden onset of dyspnea, syncope. Patients with PVCs that are greater than 6 per minute need to have a 12-lead. Patients with CHF, pulmonary edema. And all overdose patients, particularly those with tricyclic antidepressant overdoses. Now that we've talked about indications on when to perform a 12-lead EKG, keep in mind that 12-lead is a vital part of any assessment when you suspect acute coronary syndrome. Specifically, we want to try to identify those patients that are having an ST segment elevation MI. I would recommend and suggest that you incorporate the 12-lead EKG as a part of any medical assessment. It'll only further enhance and improve your ability to properly care for your patient. Now let's talk about lead placement. Lead placement is very important when obtaining a 12-lead EKG. The purpose of the leads are to pick up the electrical impulses from the heart and then transmit them to an ECG tracing that you can readily identify. There's some important things that you need to do before you apply the electrodes, and that's prepping the skin. First, remove any excess hair where the electrodes will be placed. Razor or clippers will work just fine. The purpose is to get the skin as smooth as possible so that the gel from the electrodes will adhere closely to the skin. Next, prep the skin by using a 4x4 and briskly rubbing the skin where the electrode will be placed. This actually removes any dead skin and will greatly enhance the electrode's ability to adhere to the skin and reduces any type of impedance. Even with good skin prep, you'll still get artifact. Things like patient movement, loose cables, vehicle movement, and electromagnetic interference. The key is to reduce the artifact as much as possible. All right, let's talk about lead placement now. Let's first start with limb leads. Limb leads are 1, 2, 3, AVR, AVL, and AVF. And those are acquired by the 4 standard leads. We call these limb leads because traditionally they're placed on the limbs of the patient. But let me caution you that for a true diagnostic 12-lead EKG, those limb leads need to be placed on the limbs and not on the torso like we so often do. I'll demonstrate, but with our mannequin here, obviously I can only put them on the torso. Right arm. Right leg. Left arm. Left leg. Again, these 4 basic cables represent your limb leads. Leads 1, 2, 3, AVR, AVL, and AVF. Again, if you put them on the torso, that's okay. Make sure that they're furthest away from the heart if at all possible. Ideally, the arm leads need to be on the deltoids and the leg leads need to be on the limbs. Now let's look at our precordial leads or our chest leads. Those are V1 through V6. V1 should be placed first. Find the proper anatomical location of V1. Should be the 4th intercostal space just to the right of the sternal border. Simply follow the clavicle to where it meets the sternum. That is the 1st intercostal space. Come down, 2nd, 3rd, 4th. 4th intercostal space. V1 will go just to the right of the sternal border. Next will be V2. V2 goes fourth intercostal space just to the left of the sternal border. Next, apply lead 4. 4 will go fifth intercostal space mid-clavicular. Next, apply V3. V3 goes directly in between V2 and V4. Next lead is V5. V5 goes in the same horizontal plane as V4, but in the anterior mid-axillary line. V6, again on the same horizontal plane as V4 and V5, but mid-axillary. Now that you have all your leads attached, you can perform your 12 lead. Simply find the button that says 12 lead, push it. It's going to ask you to enter a patient's age. Use a toggle switch, enter the patient's age, and press. At this point, it's going to say acquiring 12 lead. You'll wait as it analyzes the 12 lead, and then when it's complete, it'll print it out. Now, to transmit the 12 lead to the hospital, it's very easy. First, you want to hit Transmit, select Data, go to Report, and you want to select 12 lead, go to Site, select the proper site. For our purposes, we're going to use Test, but if you're going to be transporting to Cobb, use Cobb, Kennestone, etc. Once you select the site, go back up to Send and hit Send. Wait a few moments. It's going to connect and it's going to ask you the device to use. Simply scroll down to the unit that says STEMI and select. Remember, when you transmit the 12 lead, it's going to go through the OMG on your unit. So be as close as possible. Don't delay patient transport or patient care. You can easily transmit the 12 lead en route. That's it for 12 lead acquisition and transmission. If you have any questions, please give me a call. If not, take care and look for the next training in Webisode.